Hey everyone, it's me, Trunks. And me, Goten. So, today we're going to be playing this game called Head's Virtual Hip Resurfacing. So, apparently it's like a surgery game. So, let's see. Looks like this is where we start. Alright. So, let's see.
Hello. You're about to embark on a surgical mission called Total Hip Resurfacing.
Ooh.
I'm Dr. Mark.
Hello.
You will assist me in the operating room. You think you can handle it?
Oh yeah, we can do it. Yeah, we can do it.
Today, our patient is a 55-year-old man with healthy bones and no significant bone loss due to arthritis.
Huh? I don't know what that means. Do you? No, not really.
Because of his young age and normal anatomy, hip resurfacing surgery will preserve more bone than a total hip replacement.
Okay.
Why do you think it's important to preserve bone in younger patients?
Oh God. What does all this mean? I don't know. I don't know. I'm just gonna guess.
That's correct. As you can see,
right. Good job.
most of the cartilage or cushion between the bone is gone, especially in this upper portion of the joint. The prosthesis we use during surgery will need to fit our patient. To do this, we use templates that determine the approximate size. Let's start with the acetabulum or cup of the hip. What size do you think fits best?
Let's see, which one fits best? I'm gonna guess.
Want to be your patient.
That
we
one,
now know the size of the acetabulum will be 60 millimeters. The femoral head will most likely be 6 millimeters smaller.
Head.
What size femoral head should we use?
I don't know.
Sorry, that's wrong.
I'm just gonna guess.
Yes. With our templating done and our patient prepped and draped, it's time to operate. Scrub in, stat.
All right. Yay! Oh, okay.
Use the sterile marker to draw the location for our incision.
Okay. Marker. I'm gonna write my name. Goten, stop. Alright, here we go. I don't know. This is kind of... I'm gonna write my name. Okay. Goten. Okay. I'll write my name too. Trunks. Why are we writing on a patient's leg? I don't know. Because why not?
Now for the incision. Grab the scalpel and cut through the skin and subcutaneous layer of fat.
Okay. Oh!
Nice slice. Next, cauterize the blood vessels with your bovie. This will reduce blood flow into the surgical field.
What's a bovie? I'm guessing it's this thing. Ew! Ew!
Now, we'll soak up the remaining blood using a lap sponge. These retractors will hold the skin and fat layers back so we can get to the muscles underneath.
Ew!
Take the scalpel and cut through the tensor fascia lata and split the gluteus maximus along the fibers of the muscle.
Okay.
Next, cauterize the blood vessels with your bovie.
This is so weird. I know.
Now let's pull back the split muscle using the deep retractor.
Ew!
Watch out for the sciatic nerve, which can be felt through the fat. If we damage it, our patient will lose feeling and have difficulty using his leg.
Ew!
I'll use 2 retractors to separate the gluteus medius and expose the piriformis tendon. Then I'll cut the short external rotator muscles and suture them out of the way.
Ew.
See the flexible capsule around the joint? Let's cut open this capsule and hold it back with sutures.
Oh, God. Ew!
I'll need you to dislocate the femoral head.
Okay.
Do this by flexing and rotating the femur.
What do we gotta do, move the leg?
Great job.
Ew.
Now we can see the entire femoral head and how arthritic the joint is.
It does look
Using
like
a
an ice
sizing
cream.
gauge, measure the head and neck of the bone. The head size will influence which prosthesis size to use.
What's a prosthesis?
Seeing we have already templated prior to surgery, why measure the neck of the femur again?
I don't know, to use another cool looking
Sorry,
instrument?
that's wrong.
No? Okay. I don't know.
Nice job.
Okay.
I've estimated the center of the femoral neck and marked the bone using a bovie cautery device.
Okay.
Now place the guide wire, and I'll confirm that the position is
Guide wire?
accurate in 3 ways.
I don't know. Just gonna click that.
First, the alignment guide shows that we have found the
I don't
center
know.
of the neck, and not just the center of the head. Second, if we centered the guide wire properly, this feeler gauge should rotate freely around the neck of the femur, which it does. Third, I'll finish placing the guide wire and check to see where it exits the bone. Why are so many steps taken to ensure that the center of the femoral neck is located?
I don't know. I'm gonna guess.
Try again. Good job.
Okay. There we go.
Grab your drill and pass it over the guide wire to prepare the femoral head for the guide wire. And make sure you don't go deeper than the red line. That line corresponds to the size of our prosthesis.
Yay!
That's some good drilling. Place the guide rod over the guide wire until the collar is flush with the surface of the femoral head.
Okay, let's see.
Good job. To fit the prosthesis, we need to shape the outside of the femoral head with a cylindrical reamer one size larger than our prosthesis.
Reamer? I don't know. Ooh, what's he doing? I don't know.
Your mom would be so proud right now.
Yes,
I will finish with a smaller reamer.
She would be proud. Yeah. Oh, it's
Great.
pink.
We have changed the diameter of the femoral head to the correct size.
Okay.
The next step is to shape the top of the femoral head with a hemispherical reamer. This reamer will allow for a
What does this do? Oh, look. Now it's all pink.
You're unnatural.
What is that?
Before we fit the trial component, take the rongeur and cut off the small amount of bone left at the top of the femoral head.
Let's cut it.
Now place the trial component on the prepared bone.
Ooh, it's blue. Yeah.
Fits like a glove. Good work.
Like a glove.
The head diameter is larger than the component used in traditional total hip replacement.
Let's see.
Why will a larger head diameter give our patient an advantage?
I think it looks more impressive.
Ooh, I would not want to be your patient.
I don't know. I'm gonna guess.
That's correct. In order to make room for work on the acetabulum, we will move the femoral head into the pocket created in front of the acetabulum.
Ew!
This allows us to see the acetabulum clearly for the next step.
What's an acetabulum?
During pre-op planning, we chose a 16mm prosthesis cup for the acetabulum. We will need to gradually increase our reamer size to prepare the cup for the right component.
Okay.
Generally, a cup 1 to 2 millimeters larger than the final reamer size is inserted for a good fit.
Okay, let's see this. What's this? Ew! Blood! Ew!
You've done this before, haven't you?
No,
I will finish preparing the acetabulum for the prosthesis cup with the size 58mm reamer. Now we mount the cup on an insertion device, which also serves as a guide to help find the correct orientation.
Okay.
Align the device with the lines shown.
Alright, let's see. There we go.
Tap the cup into the acetabulum until the bone completely surrounds the edge of the... Before we test the prosthesis, we need to remove any bone spurs using the rongeur.
What are bone spurs? I don't know. These little things, I guess. Ew!
Time to test the prosthesis for stability. If the hip is able to move freely, then we know the prosthesis is not likely to dislocate. I will pick up the leg and make sure it straightens all the way.
I guess it
Then
moves.
rotate the foot and knee out and away. Then rotate the leg inward toward... Finally, push the... This test shows good range of motion and hip stability.
Nice.
It looks great. Okay, let's put the real prosthesis in. First, we'll dislocate the femoral head and remove the trial prosthesis.
Okay,
Now we're ready to cement in the permanent femoral prosthesis. Use the burr to create a small trough in the femoral head where indicated.
Ooh!
Why do we need to make a small trough?
What's a trough? I don't know.
Grab some cement and spread it onto the femoral head.
Ooh, cement. Yeah, cement.
Then use the impaction device to gently tap the prosthesis in place.
Okay. Got it.
Now we'll wait for the cement to harden.
Okay.
I will put the hip back into place and check range of motion one more time.
Looks pretty good.
Nice job. Time to close. This part is a little complex, but you've proven how skillful you are. So drill 3 small holes in the femur.
Alright. Nice.
Okay, let's suture hip capsules to the holes you just drilled.
Ooh, look at that.
I'll suture the deep tissue, and you take the subcutaneous fat layer.
So what? Oh, this. Alright. Cool, we're giving him stitches.
Now use staples to close the surface of the incision.
Wouldn't that get rusty? I don't know. That looks like it would hurt. Yeah, I know.
Your technique, flawless. The OR team will bandage the incision and move the patient to the recovery room. Our patient will remain in the hospital another 2 to 3 days, followed by 3 to 6 weeks of recovery and physical therapy. The downtime will allow his muscles to heal and strengthen. Following that, our patient will have significantly less pain and a higher quality of life.
Awesome!
One thing about this surgery that makes it great for younger patients is that it preserves bone, as you can see from this post-op x-ray. Thanks for helping out today, and good luck with the rest of your residency training.
No problem, man. Yeah. What's this? Hip resurfacing photos of a real hip surgery? Let's take a look. Okay. Alright, what's this? Oh, looks like the thingy. Ooh, pretty colors. Oh! Oh! Oh, God. Ew! Oh! Ew! Ew! Ew, why are we looking at this? I don't know, but... Oh! Blood! Ew! 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 Look at it all on the thing! Ew! Oh, God. Ew! Oh. Oh. Ew! Oh, God. Ew! Well, oh, God. Well, this game was pretty fun. Yeah, until we had to look at all the pictures. We didn't have to, you chose to. Yeah, we're gonna have to, edit that so people don't have to see that. Yeah. Well, anyway, guys, thanks for watching. Let us know if you want us to play any other games or if you want us to collab with another YouTuber. Yeah, thanks for watching. Bye. Bye.